To the extent that we live our lives in a manner that is consistent with the truth in our heart, we thrive.
Welcome to the Meier Clinics podcast, and you just heard a quote from one of your hosts, Dr. Lisa Day. Join our licensed clinical professionals from various backgrounds as they discuss fascinating mental health topics with a wide range of guests. Meier Clinics is a Christian counseling organization with multiple clinics nationwide dedicated to treating the whole person, emotionally, physically, and spiritually. Welcome to our listening family. We thank you for joining us. Hi everyone, Kristin Sinonto-Walker here, and we are doing our roundtable discussions with Dr. Paul Meier this evening. Paul, thanks for coming on the show.
Nice to be with you, Kristin.
Yeah, and we had such a great show last week. I'm sorry I missed it, but I just listened and it was fantastic. And Grant Davis returns, who is a nurse practitioner with the Meier Clinics. Grant, thank you so much for coming back on the show.
Yes, thank y'all for having me.
Absolutely. I hope these were fun. I hope these are fun experiences for you.
Oh, it's awesome. Love it.
Great. Well, tonight we're going to talk about something that it's a crisis for a good reason. We have some statistics to back that up, and we know that it's a crisis because we hear about it everywhere. And we have so many shows we do on the network with first responders and their mental health issues, and they report back to us what they see going on across America as well regarding the opioid crisis. So thank you both so much for coming on to talk about this and other addictions as well.
Yeah, I'll start it off by just quoting a few statistics for people, for our listening family, to hear the severity of the problem today. And back in 1980, there were 6,000. That's, one is too many, but there were 6,000 deaths from overdose in 1980. In 2016, I'm sorry. In 2016, the New York Times estimated that there were 64,000 people that died of documented overdoses, and about 42,000 out of those 64,000 were from opioids. And it's even higher in 2017. And, we've talked before about the teen suicide rate being 300% higher now than it was 50 years ago. And there have been studies also where they ask older teenagers and people in their 20s, what's your purpose in life? And back when I was 21, the most common answer was to make a contribution to society or to have a nice family or things like that. And now the most common things are to enjoy today or more narcissistic goals. And I've talked to a couple of young people this week that Grant and I both work at the day program, where we see people that come in 7 hours a day, 5 days a week for 3 or 4 weeks and get intensive therapy. And we see a lot of young people that come in there who, when we're asking them what they're so depressed about, one of the main things they bring up is they just don't have meaning in life. And I ask them, how many close friends do you have that you can share anything with? And they say things like, you mean there are people like that? That they just don't have that. And two main things drive addictions, and that's shame and lack of connectedness. And shame is false guilt and low self-esteem, and then lack of connectedness is one of the biggies that has caused the increase in the people using opioids to numb their pain.
Right.
And then one more thing, and then I'll shut up.
Nobody ever wants you to shut up, Paul.
Yeah, the opioid pain medications cause depression. For one thing, people who are depressed are more likely to abuse opioids to numb their pain. But also, if you took 100 happy people and made them take those addicting pain pills every day, then an awful lot of them would get depressed and suicidal. And a lot of people that die are not trying to commit suicide; they're just accidentally overdosing on it. But because they are depressants, they lower the serotonin level in the brain. So the opioid pain medications, as well as heroin and things like that, actually make people more depressed. So
Yes, they do. They do. Melanie Van, I think you jumped on too, correct?
I sure did. Can you guys hear me okay?
Hi, Melanie. Yeah,
Hey, Paul.
welcome aboard.
We have a
Thanks.
quattro tonight. So, a question for both of you or all of you is there are many people that come to doctors' offices for legitimate pain problems, chronic pain, and they are prescribed what they're prescribed in order to handle it, and then they become addicted. And I've read so many things, and we've had so many guests that have talked about, that overdoing it with these medications can actually trigger more of a pain response than is actually related to the original injury, that's part of the addiction process. So to
That's
me,
called rebound pain.
yeah. So
if you didn't have any pain and you took an opioid pain medication every day, and you'd start having pain from the medicine itself, called rebound pain.
Well,
Really?
Dr. Meyer,
Go ahead,
also,
Grant.
opiates actually do produce a phenomenon called opiate-induced hyperalgesia, which means opiate-induced hypersensitivity to pain. So specifically with the opiates, there is a phenomenon that happens that physiologically that is a little bit different than rebound. That is actually a sensitization to your pain receptors. Kind of you start to experience pain in a different way when you use opiates chronically.
Mhm.
So what you're talking about, Kristin, is a true phenomena specifically. You can get that with over-the-counter ibuprofen. If you take that every day, you can get a rebound headache, or Tylenol every day. But with the opiates, there is actually you become more sensitive to pain that is unique to opiates.
So that's
That is a real thing.
the key is the sensitivity, more sensitivity to it. So what you maybe would have been able to handle without having ever taken opioids, now you can't because of that. Oh my God.
And it sounds like semantics, but I think for some people probably dealing with addiction or opiate dependence, it sounds like semantics, but there can be a difference for a lot of people. When I have treated people or helped treat people with opiate dependence with a medicine called Suboxone, which is where we help people get off opiates. And there are people who they say the majority, a lot of people that end up dependent on opiates started from they had a chronic injury, and then they've been on these hydrocodone or Vicodin or opiates, and they've just been on them for years, and they can't stop because they go through a very painful withdrawal process that makes them feel like they're dying. It's not actually a medical emergency. You just feel awful for several days, and usually you end up finding something. You go to extreme lengths to get some medication so that you can avoid those withdrawal symptoms. But there are people who never take more than what they're prescribed. But if they don't have the medicine, they feel sick, like they need to go into the hospital.
Right.
And so, it's kind of, we're dealing with people who absolutely misuse the drugs. They start with opiate painkillers, and then they move on to buying them on the street or buying heroin, all of those things. But there are people who, have been on, Vicodin for 10 plus years, same dose, and just end up on these medicines, and they can't not take them. So, so they feel.
And I think doctors should not use them unless they're absolutely the last resort. I'd probably be an extremist if I was a pain doctor. I'd probably only use it if somebody was within 2 months of dying of cancer or something. But that's probably going too far. But there are some uses for people that use it once in a while for a rare migraine or something. But if I feel sorry for anybody with chronic pain, whether it's from arthritis or whether it's from an injury or a slipped disc or whatever it's from. If you have pain every day, then you're going to get angry, and you'd be stupid if you didn't get angry. If I had pain right now, I'd be angry, and I'd be an idiot if I didn't get angry. And depression is called anger turned inward. So if you have pain every day, you're bound to get angry every day. And if you get angry every day, that depletes serotonin and makes you more depressed, and that makes it even worse. And then if you take a opioid pain medicine for your pain, then that also lowers the serotonin and makes you even more depressed. So what Grant and I do, if we have clients, which we have quite a few that come in with chronic pain, that there are psychiatric medications that will get rid of the pain or lessen it significantly. Like
Really?
there's 3 antidepressants that will do that. Pristique is one that will greatly decrease pain, but you may have to do double the normal dose. The normal dose is 50, so you may have to go up to 100. And Cymbalta, the normal dose is 60, but you may have to go up to 120. And it takes about a month for it to do it, but it'll get rid of a lot of pain or either eliminate it or decrease it a lot. And then Grant taught me one. I asked him this week, I said, are there any other ones? And he said, yeah, Petzema. Is that right, Grant?
Yeah,
Petzema? That's another one that does that. And then there's those are serotonin medications. And then we have GABA in our brain. That's what puts the brakes on our worries. And a lot of the GABA meds, like Neurontin, Lyrica is one that helps pain. That's not addicting, but it doesn't help anxiety a whole lot. But Neurontin and Lamictal, Neurontin, you can load somebody up and help them right away with anxiety and their pain at the same time, and you don't have to wait a long time. Lamictal I love, but it takes about a month or 6 weeks to get them on a normal dose. You got to climb up slow. But when they get to a good dose of that usually will eliminate not only anxiety and panic attacks, and it's the best medicine for bipolar, but it also helps take away cravings for alcohol and illegal drugs, and it reduces pain significantly. They even use that in Topamax and other GABA medicines to treat headaches and to treat pain, as well as we use them in psychiatry. So there's psychiatric meds that Grant and I will use that can help reduce the pain without them having to take all those addicting pain medicines that are so bad for you. And I really feel like doctors, most doctors are good guys that mean well, and there's probably some that mean well that give people too many of these, but I think some are just drug pushers. They're just like a drug pusher out there on the street.
Absolutely. So how, here's something just, from personal experience, and I know I've talked about my ex-husband, and he definitely has chronic pain. He won't take anything more than tramadol now because he's afraid of, getting addicted again. So, and he rightly has pain, multiple injuries from football and all kinds of things. So, but
so you would do great on the ones that we just talked about.
I know, and what's so funny is like Pristique is I love it. Like I will not live without my Pristique. It just, the world is a happier place because I take my Pristique. So and Wellbutrin, 2 great things. But what's so funny is now he's not so much this way because of course look at what I do, and he's my closest friend, so he can't be this way. But for a long time, if you had said that to him, well, why don't you take these medications? He would say, I'm not depressed. I don't need to take psych. Like a stigma around it. Like that would say something about him. And I used to say, yeah, but you're addicted to opioids. So why is that okay? And saying that you might take a mental health medication and somehow you've got these standards.
I hear that a lot. I hear that a lot with weed. A lot of that with marijuana.
Yeah.
Okay, smoking marijuana for depression and anxiety, but the thought of taking an antidepressant is just ridiculous.
So how do you all get around that? Because same thing, marijuana too. I've heard that too, and I think, okay.
Well, some people are willing to come in and say, Dr. Meier, I came to see you because I'm depressed, and can you help me? And then there's other people that say, Dr. Meier, I have all these symptoms, but I know I'm not depressed. I would never be depressed. But I feel like crying all the time, and I wish God would let me die. And I wake up in the middle of the night and can't get back to sleep. And, and then they go on with all the symptoms. And they say, but it's just my fibromyalgia, or it's my chronic fatigue syndrome. And some people do have those things, but probably 9 out of 10 people that think they do don't, and it's a way to save face and not have to admit that they're going through depression. I don't want to tick off the people that are listening to me right now, because maybe it's not 9 out of 10, maybe it's half and half, because a lot of people really do have those things. But I tell them, well, you know what? Even if you're not depressed, if you're having chronic pain and these things help chronic pain, then it's sure not going to hurt you. So we use these to treat fibromyalgia and these other things that you're talking about too. So if that's what you do have, then it's going to help you. And so I talk them into taking it, and then when they feel better, I don't care if they call it depression or not. If I can make their lives happier, and yeah.
Exactly.
But the symptoms, what was odd in this article, like I said, I read an article that summarized 54 research articles on opioid addiction, and they said, now here's the main symptoms of somebody. If you want to know who's abusing opioids, here's the main symptoms to look for. And I was shocked when I read these: depression, social isolation, irritability, mood swings, agitation, financial difficulties, and lying.
Oh my God, those are all.
They're all symptoms of depression.
Yes. Oh my gosh.
And so it's either depression. It's either depression causing them to use opioids to kill the pain, or it's the opioids causing them to be depressed. And I think it's probably 50-50. They contribute to each other.
Grant, what do you say to people that have that argument?
Well, usually if they're in my office, things are not going well in their life. So I try to highlight how what they're doing, what they're using is not really working, and try to offer them a different solution. Usually you're not in my office or Dr. Meier's office or in Melanie's office for counseling if things in life are going fantastic. So when someone comes in and say, oh, my anxiety is a 10 out of 10, I'm horribly depressed, hobbies are not enjoyable, but I smoke, weed multiple times a day, or I'm drinking, 6+ drinks, to self-medicate. And trying, it's like, well, let's try one of these medicines, and if you get any pushback, clearly what you're doing is not working.
Right.
So here's an alternative to that. Here's something that we know is FDA approved, they've done clinical research on, it helps symptoms. I try to show them the research that shows that marijuana is a central nervous system depressant, that it's going to make depression worse. It's actually going to cause a rebound anxiety when you stop smoking marijuana, and so that's likely to continue to smoke more and more and more. So that you're continually, you're taking marijuana for anxiety, but then when the cannabinoids and the THC start to leave the receptors, that's part of its withdrawal process is a rebound anxiety, so you smoke again.
Wow.
And so you're creating the problems too. And just try to highlight that you're here for a reason, and try to present the evidence to them and say, hey, we'll try this out and let's see if it works and see if you don't feel better.
Yeah, it's that thing that's still there, that stigma around medication. I mean, I've had people argue with me who have done just that, who've gone into a full-blown panic attack where they're driving themselves to emergency rooms thinking that they're dying. They're smoking so much marijuana that it's unreal how much their lungs are able to. It's unreal. And then they start having these anxiety attacks and panic attacks, and they'll go see someone like you or Paul, and they will, get a prescription for an antidepressant of some kind. And then it'll make them feel kind of funny for a few days or whatever they think it is. And then they'll stop taking it. They won't let it run the full course and get it adjusted and keep doing whatever. They'll go back to the marijuana. And I think this is a loop that you're in, and it's going nowhere good.
Yes. And of course they feel good. I mean, when you're high, you feel good. And that's why people want to continue to use marijuana to get that high. But
the more you have to do to get there.
Yeah, exactly. And I think as marijuana starts to become legalized in a lot of different states, I think that the research has shown that the perception of risk with marijuana is drastically declining. I think that
Yes,
they
I know.
definitely went overboard. What was it, in the 70s, 80s with reefer madness? I think that was an overreaction, but now I think there's an underreaction to this is not just a drug that is without risk or danger. I know that I've treated people in a psych hospital that you can turn the genes on for schizophrenia through marijuana. You can get a cannabis-induced psychosis that doesn't go away.
It causes brain damage. It can cause permanent brain damage. I show them pictures from the Amen Clinic. If people are listening to us right now, you can go to Daniel Amen, A-M-E-N, like amen, like, but the amenclinic.com, and it's got pictures of what happens with opioids to the brain, what happens with cigarettes, what happens with alcohol, what happens with different drugs, pot,
cocaine, and various.
Let me read something from that summary article. It says sustained remission from opioids occurs in a significant minority of individuals, but it usually takes 10 or more years to emerge. And many survivors have medical and psychosocial problems that permanently impair their health, chances for employment, and overall adjustment. So it's pretty glim even for those who get treatment. The most effective treatments are therapeutic communities, where they get in residential treatment centers that use a lot of group therapy and AA type meetings and things like that. And in fact, I was glad to see that these medical doctors, very few psychiatrists are inclined toward religious beliefs, but they said that the most effective outcomes from all their research were places like Hazelden and Cairn Foundation and places like that, where they have 12-step groups, where they come for a long time, and they have 12-step groups. And a psychologist and a pastor and myself wrote a book recently, about a year and a half ago, that has to do with addictions, and it's called Be Strong and Surrender. I don't think I've ever mentioned it before on the radio.
Yet another Paul book.
It's one more book, But Be Strong and Surrender, and it goes into the 12 steps and gives a lot of advice and stories and things like that. So I'd recommend it to people that are trying to overcome things. But the two things drive most addiction: shame and lack of connectedness. So shame is where you just don't like yourself, for a variety of reasons, and then lack of connectedness means not having people that you can share your gut level feelings with. And the 12 steps, let me read them real quick. 1, we admitted we were powerless over alcohol, but that applies to heroin or other addictions too, and that our lives had become unmanageable. 2, we came to believe that a power greater than ourselves, which is God, could restore us to sanity. We made a decision to turn our will and our lives over to the care of God as we understood Him. We made a searching and fearless moral inventory of ourselves. We admitted to God, to ourselves, and to another human being the exact nature of our wrongs. Because when you talk about the things that you've done wrong, then it's easier to forgive yourself when you have a good cry and talk about it.
Yep.
6, we were entirely ready to have God remove these defects of character. 7, we humbly asked God to remove our shortcomings. 8, we made a list of all persons we had harmed and became willing to make amends to them all. And 9, we made direct amends to such people where possible, except when to do so would injure them or others. You don't want to go, do something where you'd hurt a whole family or something like that. And 10, we continued to take personal inventory, and when we were wrong, we promptly admitted it. 11, we sought through prayer and meditation to improve our conscious conduct with God as we understood Him, praying only for knowledge of His will for us and the power to carry that out. And number 12, having had a spiritual awakening, as the result of these steps, we tried to carry this message to other addicts, to other heroin addicts, to other alcoholics, and to practice these principles in all our affairs.
Hi, this is Dr. Paul Meier of the Meier Clinics. Our Christian counselors across the country have a goal of helping all those who come to us to become what God has called them to be. If you're in a situation where you're not at peace within yourself, or you just feel like there's joy that's missing in your life, we can come alongside to help you obtain peace and joy.
This message is sponsored by the Meier Clinic Foundation, a nonprofit Christian counseling ministry. The number is 1-888-7-CLINIC, 1-888-7-CLINIC.
So groups, people that get treated not only with medications to help them withdraw, which I'd like Grant to tell us about some of those.
Yes.
But people that get that, they said people that get that to help them withdraw, but also get long-term therapy that includes the 12-step programs have the best results. And I was really glad to see that the research backed that up.
Yeah, that is wonderful. And Melanie, I want to ask you, because I know we've all been chatting, but you have, the firsthand experience with addiction as well, with family members and friends and so on. So what does this say to you?
I've got so many thoughts going through my mind. We're talking about opioids, and, I immediately think about, why does someone start taking these things in the first place? And you guys had mentioned probably right around before I joined that a lot of times they are, these major injuries, or some other problem, and somehow this addiction cycle gets started. But I also want to point out, because I know someone really well who runs a sickle cell clinic, and Dr. Meier and Grant will know that there's tons and tons and tons of pain medication that goes through these clinics. And just this one thing, for example, what was expressed to me was, um, you know, people come in and they're given these drugs. They're not, all that's said to them is, this can be addictive, be careful.
Right.
And then they
Yeah.
come back in. There's just no follow-up. There's no, these people need to be doing, there needs to be,
Educated.
they need to be educated. They need to be going to groups for pain management. These are people that are going to be in chronic pain the rest of their lives. If our audience doesn't know what sickle cell is, it is a disease that almost always comes with severe chronic pain. So these people need to be, in groups. They need to be encouraged to maybe do yoga, to do other types of things, to have access to support that is outside of it. And what ends up happening in these types of clinics that's been shared with me is that most of the time, one of the first things they do when they come in is they're tested to see if the amount of medication that they're taking is actually in their blood. Half the time it isn't, because they're selling it for some other drug, heroin, or preferably marijuana most of the time, because most of the patients say that marijuana helps them in a way that this medication they've been taking for 10 years, because they're in chronic pain constantly, just doesn't touch it anymore. And so these doctors are in this, what do we do? They're not supposed to give it to them when they're not testing with the right amount in their blood. And so it just seems chaotic, and it seems careless a lot. And I think yes, when you're talking about addiction, you are talking about something that is based on shame and an inability to self-regulate. And so we need to teach people how to self-regulate. These need to be things that we talk about every day in school,
Yes.
in our lives every day. How do you do these things? How do you manage emotions? How does someone that may be like a highly sensitive person learn how to manage things that they don't? How do we recognize depression so that when we are depressed, we're not looking for something to quickly make us feel better? So I feel like it's just this huge systemic problem. But even though saying this, what are we really going to do about it? And the question is, it's hard to say. I think a lot of people, like Paul, is going to be doing something with the opioid epidemic soon, and I guess it's just educating people. But I really feel like with opioids in particular, there's just this carelessness that happens with these drugs that are so highly addictive, and there's no coaching except as you taper off one a day, and the person's sent home. There's no nothing. I mean, these are major drugs you're putting into the hand of a layman, and I just think it's really irresponsible. But then the other side of it could be, well, some people would take these drugs and never pick it up again. And so I guess it just boils down to the genes, like Paul talks about sometimes,
Right.
and whether this thing is triggered when they start taking these types of medications. I've been given these types of drugs. I used to have really bad migraines when I was younger. I can't take them. I hate the way they make me feel. They literally make me sleep for 20 hours straight. I just can't take them, and I have no desire to take them whatsoever. But my mom had an injury recently, and she was given the same types of medication that I was given when I used to get migraine. And she was like, "Oh, yeah, I see how those people, people can get addicted to those." She's like, "I really like the way they make me feel." She's 74, and of course, she's not addicted to opioids, but she really liked how it made her feel.
Yeah,
So
it makes a difference in people.
yeah,
I've been given those kinds of pain meds before. Like if I get a tooth pulled, my dentist would
yeah,
give me just a few, And
yeah,
when I take it, it doesn't do anything for me at all, except it does relieve the pain.
yeah.
But that's all it does. But I have clients who say, that when they take it, man, they have euphoria. So
Oh,
Yes.
I
sometimes
do.
a genetic predisposition can make a difference.
I
Yep.
absolutely do. I get that euphoria too. It's like someone hooked me up to nitrous oxide. It's amazing, and I don't take it because I also get very sick. Like I get sick to my stomach. Thank goodness, because I get that euphoria as well, and it also is like hide any sort of gadget that would allow me to communicate with the outside world, because I will tell people things that I should not be talking about. You know what I'm saying?
True serum for you, Kristen.
Yes.
Keep that in mind.
Yeah. You want me to tell you something I don't want, although I share pretty much everything on the show, but want me to share other things that you don't want to know about, like Wonder Woman's lasso, of truth. Hand me a Vicodin. I cannot do that. But I want us to get to, what you were talking about, Paul and Grant, about how do
Yeah.
people that have been taking it dose down. I know that psychiatric medication can help, but what are these other medications that can help people get off of opioids?
Yeah, because Grant actually treated it. So Grant, how did you treat it? We don't treat it at
Yeah.
our
So
clinics because
so
we don't do
we
hospitalization. But what do you do?
yeah we used Suboxone, which is a combination of a drug called buprenorphine and then a drug called naloxone. What it does is it prevents someone from going into opiate withdrawal, and is a prescription drug. So if they're buying their if they're buying heroin on the street, now we're giving them a drug that they don't have to get illegally, and they'll have a prescription for it. So you automatically can improve some functioning there and some safety and some various things. But the way Suboxone works is as the type of drug that it will. There's evidence that it undoes the opiate-induced hyperalgesia that opiates can cause, and it does not cause a depressing effect.
Uh-huh.
So the patients who either are just dependent, and so they take what they're prescribed, they don't misuse it, they're not trying to get a high, but they've been on these opiates for years, decades, and they can't get off, or patients who are just sick of, the addiction always starts with you're chasing this high, and eventually
Yes.
it becomes maladaptive, and you're no longer chasing a high, you're just staving off withdrawal symptoms. And so
that helps them get off, right?
Yeah.
That medication.
It helps you to get off.
And Grant, they don't get high on that drug, do they?
In theory, no. I've had addicts tell me otherwise.
Yeah.
But in theory, no. The reason they put naloxone is a very strong opiate antagonist. It prevents them from crushing the drug up and injecting it. If they were to do that, they would immediately go into withdrawal symptoms.
Interesting.
Because it would override every opiate that's attached to the receptor. It would just knock it off.
What's the drug? What's the drug that they used to use that can cause the high? Was that methadone or?
Yes, methadone.
And that's not a good thing. That's not a good thing to use, right?
I think you're. There are some thoughts out there. Hey, you're replacing your heroin addiction dependence onto a Suboxone dependence, and there is some truth to that. But a lot of times the goal is to potentially get someone off of Suboxone, and it can be easier to do. But yeah, you can get high off of methadone.
In Switzerland and some of the countries in the European Union, according to that research article, they use heroin. I mean, they'll if people are trying to get off heroin, they actually inject them with heroin. And that's doesn't seem like too smart a thing to do.
Yeah, what's the intelligence or reporting behind that?
Well, they think, and I mean, it has worked on some, but they think if they comply, then we'll give them a little bit less each week, and so we'll wean them off it. But often what they do is that's just one more place to get some, Yeah.
And what's interesting, then we've heard this from our first responder shows like Rescue the Rescuer, and we have a doctor, Mark Leeds, who does a show called The Rehab, who talks about Suboxone medication and things like that. He's helping people, get off of these, get off of opioids. And what we hear so much about is that it used to be, especially with first responders, and this is what we hear from actual first responders, okay, that they used to get phone calls and they'd know by the city that was calling in, with the issue for them to be a first responder of, they could say, okay, we need to gear up, we need to put on extra protection, we need to blah, 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 because we're going to that bad area of town. And with the opioid crisis, everywhere is a bad area of town now. They don't even go, oh, okay, well, this is going to be in, the whatever golden city of whatever in California, that we won't have any issues there. There is no good area of town when it comes to the opioid crisis anymore.
Yeah, and people will do things when they're addicted that they would normally never do.
Yeah.
I mean, they'll steal, somebody addicted to heroin would sometimes, kill their grandmother for a fix, if they're desperate enough.
Yeah.
One other thing, I think it was Melanie that asked, or maybe it was Kristin, I forgot which one of you asked that, but what are some things that we can do to help our kids be less likely to get on it? And some of the studies showed that, most kids are going to experiment somewhat with drugs when they're in high school, late teens and early 20s usually. And but only 25% will get hooked on them. And it's usually the ones that are overly dependent that are more likely to get hooked on drugs. So the more independent a child is when they grow up, then the less likely it is that they would want to depend on a drug to numb themselves out the rest of their lives. And that can involve a lot of different things in our lives and even in politics. I mean, if there's people that are hungry, some well-intentioned people say, well, let's give them all fish to eat, and because they're hungry. And there's nothing wrong with wanting to do that. But then there's others that say, well, if they're really hungry, let's give them fishing poles and teach them how to fish so they can, take care of their own families. And, maybe a little bit of both might be, right. I'm not saying one side is, better than the other, but teaching people to be independent and take care of themselves is really valuable in young kids too. If parents think too much for their children when they're growing up, that's not good for the kids.
Yes.
Don't tell them what to wear and what to do every minute of every day, and give them a little rope and let them individuate, and don't make your son be a football player if they like playing the piano, and
right.
You got to give them a little freedom. The kids that are totally compliant and you get straight A's are the ones that are the most likely to commit suicide. And kids that rebel a little bit when they're growing up are actually healthier, So.
I know, this is a fascinating subject too, and it does. I promise listeners, this is hand in hand with addiction. It really is.
It is.
What I find interesting, and I talked about this with my ex-husband, how we were very much scapegoated in our families. We were the scapegoated kids, and what that did for us is it made us extremely independent. We had to become extremely reliant on ourselves for all kinds of things. And we failed a lot because we were like, well, nobody cares anyway, or we're always bad anyway. So we might as well just try a whole bunch of stuff and fail at it and see what happens. And what that did is built resiliency. And so now that we're older, all of the people that supposedly did everything the right way with their life, not all of them, but many of them, now come to us and say, I'm having this midlife crisis. I don't know what to do. I can't, like, they don't even have the capability to handle stuff that we handled 20 years ago. You know what I mean?
Yeah.
And they're the same age that we are. And now all of a sudden we're these wise sages that, have the answers. And we look at each other like, okay, I mean, we don't have all the answers, but it's just really interesting to have what you're saying, Paul, where we weren't coddled like other people in our family was. And we did make a lot of mistakes. And there were years where people were just doing the shame finger about us, and now all of a sudden we're these wonderful people that are a success. And I just think, gosh, over the history of someone's life, that's the great thing about age, that you can look back and go, oh, all those things happened, and okay, a good product turned out of that.
Yeah. A dependent person will say, I'm broke, who's going to give me money?
Yes.
They'll say, I'm lonely, why doesn't anybody call me up? I've got this problem, why doesn't somebody come and rescue me for that problem?
Yes.
And an independent person will say, I'm lonely, who should I call?
Yeah.
I'm behind in my bills, what can I do extra, a part-time extra job or something till I get caught up? And they take care of themselves. And a huge study done on hundreds of thousands of people showed that people who are dependent, a majority of them suffer from depression. And the people that are independent, a majority of them enjoy life and are not depressed. And so it's, and the same thing with addictions. The dependent people are more likely to get dependent on drugs. It's not, it's not always that way.
Yeah.
But
interesting. That's
common.
Really interesting. Grant, what are you thinking about all this and my little windy road I took us on for a minute?
I tell you, I think that it is, I think it's very, I think you're spot on. I think you're spot on with it. We have a therapist who, at the day program, who loves to kind of rant on millennials, if you will, and I think they can be the brunt of a lot of jokes, but I think that there is a resiliency that I think that past generations definitely grew up with a little bit more than I think we do now. And I think that all of these things are, it's not just one thing that causes, any type of disorder, dysfunction, or addiction, but I definitely think it contributes with genes and, the genetic predisposition. And, I have not treated one person, not with opiate dependence, but a person with true addiction that did not have some other co-occurring mental illness.
Yes.
And largely trauma. Usually there's some sort of, and not everybody that becomes an addict was a victim of abuse, but, doing, working in rehabs and different things like that, that was a large portion of almost everyone's story was, they became addicted. They started to use drugs to escape, because of usually sexual abuse, but some sort of a trauma, and then they turn to drugs to cope. And so that's just a multifaceted disease process that is requires a treatment team approach with a therapist, support groups, medication to treat the underlying psychiatric condition if needed, drugs to help prevent alcohol cravings or to prevent, being able to get high on drugs, any mechanism you can to make it harder for someone to abuse the drug. With all those other support systems, I think you're going to have your best chances of success.
So
kids that are abused when they're growing up blame themselves. They think it's my fault. I'm a horrible child, or my parents wouldn't be abusing me, or whoever is abusing them. And so they have low self-esteem, and so they get more depressed, and so they numb it out. And in therapy, they figure out that their parents were lying to them. They don't need to go through life beating themselves up, and they can kick their parents out of their brain.
I love that you say that. That's helped me. This is every Monday night therapy for me when you know. But yeah, that you don't need to carry your parents' voice around. Some well-meaning and some not. But if you have generational trauma and it's this has been going on for decades, centuries, maybe even in your family, and it just keeps getting handed down, you can be angry at what's happened to you, and then you can do something about it. You don't have to stay in that mix, and you don't have to keep having those voices in your head telling you who you are. You can become who you were meant to be.
Mm-hmm.
Right.
That's
my self-help talk for the night. But
yeah, people still try to live up to what their parents wanted them to be rather than becoming what they want to be. And I often tell them, well, do you need my mother's approval? And they say, well, no, I don't need your mother's approval. I said, well, do I need your mother's approval or father's? And they said, well, no. And I said, then there's 8 billion people out there, and your mom's just one of them. Do you need her approval? I said, well, actually, I guess not. I say, yeah, you can live your life without it. And if she happens to change someday and accept you the way you are, that's nice. But if you count on it, you're going to stay depressed.
Yeah, absolutely. And I think we need to talk to a little bit, maybe we can focus on this for the last piece of the show. How, there's the addict that's, abusing substances, or substance use disorders is now what it's called. I like that they're taking that word abuse out of it, but because that does add more shame. But then there are people that are enabling the addiction, and that is just as much a part of the addiction as taking the drugs. So winding your way out of being an enabler, which I absolutely was, and also not allowing yourself to be enabled, which is boundaries. That's a rough road. It's I always look at it like it's like you're cleaning your film off of your glasses, and you keep cleaning and you keep cleaning by working on your trauma like you guys do, with your day program. And then people all of a sudden have a clear perspective of what's gone on in their life that got them to this place. But that enabling piece, I don't think it's focused on enough, because it's always all about the addict, and the addict doesn't get there by themselves.
Well, that's an addiction too. And like if let's say a young girl grows up with an alcoholic father, there's a pretty good chance that she's going to marry an alcoholic, partially to get the love that she didn't get from her father, partially to fix her childhood. There's a variety of reasons why we tend to do that. And then if the husband gets treatment and overcomes his alcoholism, then 50% of the time, the woman who really wanted her husband not to be an alcoholic consciously will divorce him and marry another alcoholic.
Right.
And I had a patient that I called the church lady. That's a true story. Her husband was an alcoholic. He wouldn't work. He was always drunk, and he'd hit her and beat her up sometimes. And she'd work and support the family and give him her money, let him buy alcohol with it. She'd go to prayer meeting every Wednesday night and say, "Oh, pray for my alcoholic husband." And she'd come with bruises and her arm in a sling one time, and she was the suffering saint, And finally her pastor got tired of it, and he said, "I'm going to go have a good talk with your husband." And he went and had a real strong man-to-man talk with him, and the husband repented and got help and got counseling, and within 3 years the husband he started his own business and become real successful, and was a deacon in the church, and was just a really great husband and a good father. And the wife was real depressed and suicidal, and she didn't know why, but she was depressed and suicidal because she was dependent on him being an alcoholic. And
Yes.
So when she came into our day program, we admitted a alcoholic in the program that wanted to overcome that, and she tried to end up having an affair with him, and she's not the type that would do that, but she she really wanted to divorce her husband and marry another alcoholic, but she became aware of her codependency. That's what we call it, codependency, and she worked through it and got healthy and happy eventually. But it took some
Yeah,
work.
I've had somebody that got married to someone with a lot of problems, very severe history of problems, and still obviously active in all of their issues. And they actually would say before they married this person, well, I'll just, as I help them fix their problems, then I'll heal. And I thought, oh my God, that is a marriage steeped in disaster, just right there.
Sounds like a
So,
recipe for disaster for sure.
yes, absolutely. And
Yeah.
you can't, you're right, you can't. Well, Melanie, you have your thoughts on that. What do you?
Well, I mean, codependency and whoever is an addict support system really is essential to recovery. There has to be education amongst the entire support system and not just the addict. If you're treating the addict, like if I was treating the addict as a counselor and then I know they're going into the same dysfunctional family system every single time they leave my office, then quite frankly that can leave me feeling really hopeless. So I would always try to get the other members of the families to get in their own counseling and educate themselves about whatever the addiction was that the client was dealing with. So it's imperative that the addict support system understand what their role is in recovery, because it's huge. And just like Paul was saying, so codependent is a word that we throw around a lot, but in reality it is exactly what it is. So if a person is dependent on alcohol, then the person that is the codependent is someone that is dependent on it as well. And so, in psychological terms or in counseling terms, when we talk about a codependent, we're basically talking about someone whose emotions or decisions are always dependent on someone else's reaction. So they are codependent. So you can see how this dynamic works between the addict and whoever this support system is. So
When
it's
Grant and
it's
I,
definite, yeah, it's a family disease. It
yeah,
Yes.
definitely is.
when
Yeah.
when Grant and I encourage people that are alcoholics, for example, to go to AA meetings, we also encourage their mate to go to meetings of their own. They have
Hmm.
meetings that they can go to learn how not to be codependent.
That's right. Al-Anon, right?
Yeah.
Yeah.
Yeah. Yep. Or not, or there's
Narcanon, yeah,
Narcanon. Yep. There's all sorts.
and Codependence Anonymous. Yeah,
Code-
I've been to those meetings. I just didn't. I could not tolerate holding my hand up and saying I'm codependent. My name is Kristin every time I had to go to the bathroom, because I thought, listen, I don't want to continue to reinforce to my brain that this is what I am.
I want to say one more thing before we run out of time that I just thought of that's real important for those of you listening right now who are alcoholics. I mean, we if they show if you don't have a proneness toward alcoholism and you had a glass of wine every day, you'd probably live longer. I'm not saying alcohol in moderation is bad, but people that drink more than 2 glasses of wine a night are going to have problems. But for people that are drinking a lot, like a fifth of whiskey a night or a whole bottle of wine a night or more, Grant and I would encourage you to get treatment, but don't just go cold turkey. I mean, be sure you go to a hospital or a treatment center to get treated. Get on medications that'll help you not to have withdrawal seizures and things. Because if you go into what's called DTs, delirium tremens, then some people who are drinking a whole lot and they quit, they'll start seeing bugs coming off the wall and crawling on them, and they'll have hallucinations and things like that.
And a tremor.
Yeah, and if they're not in a hospital, there's a 50% death rate from their brain swelling. If they're in a hospital, there's still about a 10% death rate, and so it's really dangerous to just be drinking a ton of alcohol and quit cold turkey. Now, Grant, you were telling me earlier that people can quit heroin right? They just get sick. They don't die.
People
can die from quitting alcohol?
Yes, people can die from quitting alcohol, benzodiazepines, and barbiturates. The three medications that can be deadly in withdrawal. And it doesn't mean that everybody will have to, depends on dose and how long you've been on things. But heroin withdrawal, it feels like you're going to die, but it is not a medical emergency. It is not a life-threatening withdrawal process.
Yeah.
Feel awful, but it will not kill you. No.
So last, go ahead. I'm sorry, Grant.
Oh, I just said it will just make you very, very, very sick.
Okay, last question that is for Paul and for Grant. So how is it because Paul in our experiences, such a cheerleader for other people. So when he asked about you coming on the show, Grant, I thought, oh my gosh, Paul is going to be so excited about this. So how is it with the two of you working together? Because Paul, you're such a great collaborator.
I'm supposed to be Grant's supervisor, because I'm the MD and he's the nurse practitioner. But Grant, how many times a week do I come by your office? And sometimes I'll interrupt Grant when he's even with a client. And I'll say, hey, what do you do for this? What do you do for that? Grant is he's a brilliant guy. He's a humble guy, so he doesn't want me to brag on him, but he's really brilliant and he's up on everything. And just like earlier this week, I said, what other antidepressants relieve pain? I knew you'd know one. And he's just a real smart guy. And he might ask me a question once every 6 months, and I ask him about 2 or 3 a week. So he teaches me.
Not that often, but it is definitely fun at Meier Clinics. I can tell you that.
Yeah, we love working together.
A whole heck of a lot from Dr. Meier. That is for sure.
Well, that's the thing I wanted the listeners to hear was that dynamic, because this is what we get from being with you every week, Paul. That humility that just is innate within you. You have so much and you freely give out of your abundance to other people. And it's a beautiful thing to get to be around.
I love doing what I do.
Yeah.
I plan to keep doing it till I'm in my 90s or until I'm too senile to know my name.
Oh no, they're going to be kicking you out at Meier. That's what's going to happen. You're going to come in so old and feeble, Paul and Grant. It's going to be giving you little hints, and that's what's going to happen. And everyone respects you so much, they're going to be like, "Oh, just let him come in. Just let him pretend to practice medicine."
And I've already told my nurse. My nurse has been with me for about 18 years, and I already told her, but she's younger than me, And I said, I already told her, when I get senile, you're going to have to sit in on every session that I have with a patient. And I'll say, well, what do you think? I'll say, Lynn, what do you think we ought to do? And whatever you say, we'll do it,
Well, thank you both for coming on. This is a serious subject. I'm glad that we could take, a different take on it than what's out there in the news, which is very real, but it's also, and I think it's getting across to people finally. But I think Melanie hit the nail on the head with, let's get education in the hands of people sooner, and also people that are prescribed pain medication. There needs to be a protocol that goes along, and that they're required to be a part of this protocol in order to keep getting the medication. So that education from early on, and also as you take it, is something that needs to start happening more. Otherwise, I don't know how this is going to end up for us.
Yeah, and you have a choice. You can either take the addicting meds that make you more depressed and make you more dependent and will end up killing you, or you can take antidepressants and other psychiatric meds and not all of them heal pain, but some of them do. And you can take psychiatric meds that heal the pain, that are not addicting, that make you happy, so you don't want to numb the pain. So you have a choice, and make the right choice.
Absolutely. That's the thing. We always say you have a choice. You have a choice not to hear your parents' voices in your head running your life, and you have a choice to choose what medication that you will put into your body. So you're the patient, you're the consumer. It's your choice. Right. So thank you, Dr. Meier, Paul, for coming on for another show. And Grant, thank you for joining us too. That's 2 now in a row.
That's right. Enjoy it. Thank you all so much.
We're gonna do one more on antidepressants and when to use them, when not to use them, and which ones are the best and things like that. So we'll have
Can't
Grant
wait for
one
that
more
one.
time. Yep.
All right.
Fantastic. And I want to say thank you to Lee Beat and the Beat family listening from Birmingham in the UK. Thank you so much for tuning in and for letting us know that you listen to all of our shows. We love that. And I want to say thank you to the rest of our listeners for another edition of Mental Health News Radio. We hope you enjoyed this podcast. Tune in next time for another engaging discussion on relevant mental health topics. If you have any questions about Meier Clinics, please visit our website at meierclinics.com. That's MEIER clinics.com, or call us at 888-7-CLINIC. Don't forget to leave us a review on iTunes, Stitcher, or any of your favorite podcast apps. And please note that we are a member of and produced by Mental Health News Radio Network, MHNRnetwork.com.